Hi, everyone. My name is Keetha Mercer, and I'm very happy to be working on the distribution of these grants. As you know, the pandemic has been a shared experience in some ways, but also a wildly different one in different areas of the country. For individuals and communities based on lived experiences, on barriers and discriminations. As many have said, the pandemic highlights inequities and cracks in our system that have already existed, and if anything, is further deepening them. So today we are going to be chatting with three organizations throughout the country who have received emergency funding through our Safer and Stronger grants, which are supported by the Department of Women and Gender Equality, and are addressing the surge in need around gender-based violence services in their regions. They're going to share a little bit about what they've been doing in this emergency and what needs to happen to end violence for good. So I'm very happy and honored to introduce Andrea Silverstone from Sagesse in Calgary, Deepa Mattoo from Barbra Schlifer Commemorative Clinic in Toronto, and Kristal LeBlanc from Beauséjour Family Crisis Resource Center in Shediac, New Brunswick. So I believe they will be joining me on screen here. Fantastic. There you are. Hello, welcome. So I wanted to start out with asking you what it looks like in your community. So when it comes to gender-based violence during this pandemic, what have you seen in your communities? And maybe for the first round, we'll go west to east and start with Andrea.
Thank you so much for having me and for the opportunity to share what we're seeing and for the opportunity to be a part of the great work that the Canadian Women's Foundation is doing. I think we're seeing what everybody is seeing. Our rates of domestic violence, of gender-based violence is going up. In Alberta, we've seen our rates of violence increase about 30% for women and girls who are experiencing domestic and sexual violence. We've also seen a massive increase in informal supporters of those women and girls reaching out to our agencies to understand how to continue to be informal supporters and effective in good ways in times when we have a pandemic that stops us from gathering in the ways that we normally gather to offer support to each other. And the other thing is that we're noticing that people are using services in much different ways than they ever have before. We saw that shelter usage went down, but community services usage went way up. All of a sudden, our sector had to become experts in delivering services virtually and online, which actually I think benefited our rural and remote communities across Canada because they were able to access services in more equitable ways in the same way that everybody was. And of course, we've seen an increase in the severity and lethality of what's happening for our clients because of, I think, reports to the police went down at the beginning of the pandemic and then they went back up again. I think people waited longer to call the police when they needed to or stayed in violent situations for longer because of the fear of what was outside of their doors, although what was happening behind closed doors was also really terrible. And so as a result, we've seen that lethality go up. I think overall, we've also seen some real stress for our frontline workers in our sector who are dealing with both the pandemic and making sure that they're dealing with an increasing need and complexity from our clients. And so I think that sort of for me is the global picture. But having said all of that, I think our sector has pulled together in really amazing ways to answer the call and the need that our clients are presenting with.
Thanks, Andrea. We'll zoom over to Toronto and Deepa. Can you talk a little bit about what the pandemic has looked like in your community?
Absolutely. And I'm sorry, my video gave up on me just as, it came back. Okay. It's playing a dance on me, so I would just leave it alone for now. I just wanted to say thank you to everyone at the Canadian Women Foundation for inviting us and share our experience. So very similar to my colleagues here, the stay-home orders left women experiencing in trapped situations where they were trapped with their abusers in most of these circumstances. So accessing safety became really difficult right at the beginning. And as service providers were switching to provide services online, those services were not available to many communities because of the multiple layers of marginalization, racial discrimination, as well as their immigration status issue, having an access to mobile phone, computer, or internet is not necessarily as easy as it would be for some of us who are more privileged. The close monitoring of the perpetrators and other family members further put them under duress and harm because they were losing the natural support networks that they would form otherwise in their day-to-day lives. Some of the high risk situations and severity that we saw for the young people's experience has been really hard to navigate, as well as the pregnant women, situations with pregnant women, expectant women, and non-status women. They are finding it hardest to navigate, as well as we are finding it hardest to navigate with not having our own toolbox available to us, which we usually would be going to. I really would want to kind of echo the sentiment around the COVID fatigue and the mental health challenge that the sector is facing as well because of these strenuous circumstances that, that they are navigating. But we also saw something really positive. We saw pivoting, collaboration, coordination of services. We saw community coming together for many of our survivors. Peer support came forward, donors came forward, and past clients came forward to support as well. So a lot of positive sentiment, but being a women-led sector and a caregiver-led sector, the reality of mothers with young children working at home, trying to navigate these situations has been pretty hard, as for everyone else.
Thank you, Deepa. And thank you both for recognizing not only how the sector has come together, but also how hard they're working on top of, we're all working on top of an already struggle or an already stretched workload. Kristal, can you tell us a little bit more about what it's been like in your community?
Sure. New Brunswick has one of the highest rates of domestic homicide. So of course there were immediate concerns about what would happen to those numbers during the spike of the pandemic for us in New Brunswick. One of the biggest challenges when you pivot to virtual is not only getting victims, cell phones, but it's the feeling that the staff have for, they set up a call, they know they're supposed to talk to their client, and then the client doesn't call. And there's a big part of you that she's hiding in a closet and you're concerned that maybe something's happened or is found out. So it's the idea of having just that 10 minutes while she goes to walk the dog to be able to try and sort out her safety in the quickest way possible and to sort out how to get her to services. I think one thing I'd like to highlight, particularly in our province, was the spike in requests for emergency intervention orders. New Brunswick was one of the last provinces to have emergency intervention orders. So even though they weren't maybe well known to the community yet, there was a spike in requests to get them done. And as much as there's both government and nonprofit organizations who are trained to be the assisters, we soon found out that the only people that were doing them was, of course, the women's-based nonprofit organizations. So that was exceptionally difficult on already strained staff. Having said that, I think what is positive about the pandemic, we do talk about the negative side. I think what's positive is the funding that allowed us to do things that we otherwise wouldn't have ever been able to do, and to think differently about how to meet people where they're at. And I think it also raised a spotlight on the fact that domestic violence was already a pandemic. We were living a pandemic. So I think for the public and for the press in particular, who of course, found it interesting to better understand what it means to be stuck at home and not to be able to break free from domestic violence, it shed a spotlight on it. And I'm hopeful that as terrible as it's been, that it may shift the thinking of what's needed for core sustainability for our organizations, or at least it's being talked about more. I don't think that the same spotlight would be on it if it wasn't for COVID-19. So I think in that situation, there's an opportunity and a desire and maybe an avenue for change.
Thanks, Kristal. And you mentioned a little bit about the funding. Can you tell us a bit about how your organization has been responding to these challenges and how you've used the emergency funding?
So we had received different batches of funding during COVID-19. So specifically funding from the Canadian Women's Foundation through the federal government. Some of our funding was that we offer sexual assault services. And one of the biggest challenges was we had a RCMP comfort room, and we had just built a new building, but we had no funding for the actual equipment so that statements could be done at our location instead of the police detachment. And because of COVID-19, we weren't able to go with women to our detachment because basically the interrogation room, which is the same one they use, by the way, for abusers, was like a closet. So they were basically saying, sorry, it's the client only and the police officer. And we have big problems with that. We have advocacy work we need to get done. So we were able to provide, a safe COVID-19 friendly service because we had bigger space. We just didn't have the equipment. And it's not something I could have ever afforded if the COVID-19 funding wasn't available. Through the Safer and Stronger grant that we received just a week ago, we're excited because there's funding for us to be able to download the WISH software. Over 10 years ago, we developed a problem with our database, and we're in a rural, remote community, and we do our best, and we're grassroots. So we were doing everything on paper, counting our stats, and it's impossible when your numbers start to spike like they have been during the pandemic. So it became critical that we had a database to be able to, upload a perpetrator's photo, and so that way there we can just more effectively case manage our files. So something like that, I wouldn't have been able to take from my regular budget, not with the crazy cost and PPE supplies and everything else that we're having to do. So definitely the software is going to be critical. There was also funding for us to hire somebody part-time to help us with the increase in mental health issues that we're seeing for our second stage clients. So it's just been such a blessing to be able to do those things.
Thanks, Kristal. We've heard a lot about the need to upgrade technology or get technology, and organizations were struggling to get by before the pandemic, but when everybody moves to working from home, it was even more necessary. Deepa, can you talk a little bit about how your organization has been responding and how you've been using the emergency funds?
Yeah, sure. So for the clinic, I think right at the beginning, the late March, when the lockdown started happening, it was really important for us to send the message to the community and the survivors we work with that our doors won't close and we will remain open. And our messaging was, we will remain open till we are told not to. So we very quickly pivoted, and we were fortunate because we were already on a cloud system, so it was easy for us to get a lot of our direct service staff to set up home offices. But what we needed to do was to remain open in our main office, where we could still receive clients, the unplanned walk-ins, or those emergency situations where people need in-person services still amid the pandemic. So we were able to use the funds made available through emergency funding to bring in self-care packages for survivors, cell phones, tablets, SIM cards. We got some donations, and some of the emergency funding money supported us. We were able to get plexiglass installed throughout the space so that people who are coming into the clinic, which we called a high-risk team, which included mainly managers and a couple of our admin staff, till today, we take turns in rotations. Today, I am in office and I'm speaking from that space. We made sure that the space was safe for us and people dropping in and coming in, which has been extremely, extremely helpful. We have also been able to do a lot of education, a lot of support groups for the sector as well as the survivors. We have been running webinars for sexual assault survivors, for women who are criminalized, especially non-status folks who are criminalized, and the criminalization saw a spike through this time. So a lot of this money which came through the emergency supports made it possible for us to remain open and remain committed to what we said, and right at the beginning, we will remain open till we are asked to close. And we were fortunate that we were declared an essential service, and that did help. And we have been able to utilize our large meeting rooms for safe zones for meetings throughout this whole time. One of the other really important a resource that the funding was able to create for us was to have safe platforms for women to connect with us. which otherwise is not possible. So we very quickly discovered that an email from Schleifer is not necessarily the right email to receive. So having access to the technology, which could morph and hide the identity of the Zoom platform or hide the identity of the emails, all of those features that are really otherwise very difficult to access, we have been discovering those and making sure that our services remain available in a safe way. Thank you.
Thank you, Deepa. And Andrea, back over to the west side of the country. How have you been able to respond?
So one of the things that's really interesting that's happened during the pandemic is that all of the things that I think that we knew about how clients help seek have not been the way that clients have helped seek, that women and children have helped seek during this process of COVID. And so, like I mentioned before, all of a sudden we saw that the rates of people who were using shelters went way down. The rates of people who were calling the police went way down. Although calls to crisis lines went up somewhat, it wasn't as much as we expected. And so the question was, we know that people are trapped in their home with their abuser. Where are they going? And so we actually partnered with a data analytics company called HelpSeeker and the University of Calgary Shift the Project to End Domestic Violence to ask that question. And one of the things that the first thing that happened is when HelpSeeker did a data analytics on help seeking based on Google metrics, which I can't explain to you because I don't understand. What I do understand is that they said to us, the Google searches for domestic violence services in Alberta have gone up 136% since the COVID pandemic began. And so we knew that whatever we were doing was not meeting the clients where they're at, which is one of our core principles. And so we partnered with HelpSeeker and Shift the Project to End Domestic Violence to create a project called Data to Action, where we're trying to get real-time data from participating data contributors from across the province of Alberta about how service usage and rates of domestic violence look, as well as doing behind-the-scenes system mapping and Google metrics around how clients are help-seeking and how they're moving from service to service in a time and using them very differently, so that we can inform our sector and the Alberta government and other investors about how investment needs to change and be flexible during this time. One of the things that I've really appreciated about the Canadian Women's Foundation and other funders is that there's been real conversations about, we funded you for this thing, but we know that clients probably aren't showing up that way anymore. Do you want us to move the funding over this way? But we need to know how to move it. And part of what the Data to Action project is going to tell us is that information. And so we've been very lucky to get some very key data contributors already on board in Alberta, like Alberta Health Services and, our major police services, but also, the large shelters, as well as, on grassroots domestic violence and faith-based organizations. And so I know that this is actually a project that we would like to eventually see Canada-wide, because I think that Alberta is not the only place experiencing this knowledge gap around how clients are help-seeking in a different way. So thank you. It's super exciting, and we'll let you know when the first data dashboard is published.
Yes, please. I think it'll be really key information for all of us. Thank you all for being here and for the hard work you're doing. I know that this pandemic has created all sorts of new challenges for you. And one thing I always say is how amazing women's organizations are at adapting and collaborating and figuring out how to meet the needs. So thank you for being here and for the hard work you do every day. If your organization does gender-based violence programming and would like to apply for the Safer and Stronger program, we'll put the link up in the chat, but it's also on our website. The next deadline is Tuesday, February 16th. And we are looking forward to continuing to support programs like these three and other ones throughout the country.